Nurse Aide Written Exam Answers. Question 1. Which of the following demonstrates respect for a resident's cultural beliefs? Option A. Expecting all residents to follow the facility's meal schedule. Option B. Learning about and accommodating the resident's cultural preferences. Option C. Telling the resident their beliefs are unusual. Option D. Ignoring cultural differences. The correct answer is option B. Learning about and accommodating the resident's cultural preferences. Question 2. The nurse aide notices an unusual odor coming from a resident's room. The first action should be: Option A. Spray air freshener. Option B. Investigate the source and report findings to the nurse. Option C. Ignore the odor. Option D. Open the windows. The correct answer is option B. Investigate the source and report findings to the nurse. Question 3. When performing perineal care on a female resident, the nurse aide should: Option A. Wash from back to front. Option B. Wash from front to back. Option C. Use circular motions from outer to inner. Option D. Wash only with warm water and no soap. The correct answer is option B. Wash from front to back. Question 4. When speaking with a resident, the nurse aide should: Option A. Stand over the resident while talking. Option B. Use complex medical terms. Option C. Sit or stand at eye level and use a respectful tone. Option D. Speak quickly to save time. The correct answer is option C. Sit or stand at eye level and use a respectful tone. Question 5. A resident becomes sexually inappropriate with the nurse aide. The nurse aide should: Option A. Laugh it off to avoid embarrassment. Option B. Firmly but respectfully set boundaries and report the behavior. Option C. Respond in kind. Option D. Never report the behavior. The correct answer is option B. Firmly but respectfully set boundaries and report the behavior. Question 6. When transferring a resident with a mechanical lift, the nurse aide should: Option A. Operate the lift alone for efficiency. Option B. Position the sling under the resident's arms only. Option C. Use the lift with at least 2 caregivers and follow manufacturer instructions. Option D. Transfer the resident without explaining the procedure. The correct answer is option C. Use the lift with at least 2 caregivers and follow manufacturer instructions. Question 7. When feeding a visually impaired resident, the nurse aide should: Option A. Feed the resident without describing the food. Option B. Describe food location using a clock face method. Option C. Mix all food together for easier eating. Option D. Stand behind the resident. The correct answer is option B. Describe food location using a clock face method. Question 8. A resident has a urinary catheter. Which action by the nurse aide is correct? Option A. Keep the drainage bag above the level of the bladder. Option B. Empty the drainage bag at least every 8 hours. Option C. Keep the drainage bag below the level of the bladder. Option D. Disconnect the catheter to empty the bag. The correct answer is option C. Keep the drainage bag below the level of the bladder. Question 9. A resident has elastic stockings, TED hose, ordered. The nurse aide should apply them. Option A. While the resident is standing. Option B. While the resident is sitting in a chair. Option C. Before the resident gets out of bed. Option D. Only after the resident has walked. The correct answer is option C. Before the resident gets out of bed. Question 10. When making an occupied bed, the nurse aide should: Option A. Keep the resident in one position throughout. Option B. Raise both side rails and leave the resident. Option C. Keep the resident covered and turn side to side. Option D. Place dirty linens on the floor. The correct answer is option C. Keep the resident covered and turn side to side. Question 11. When assisting a resident to ambulate using a gait belt, the nurse aide should: Option A. Hold the belt with an overhand grip. Option B. Hold the belt with an underhand grip. Option C. Not use a gait belt for residents who can walk. Option D. Pull the resident forward. The correct answer is option B. Hold the belt with an underhand grip. Question 12. A resident asks the nurse aide for financial advice. The nurse aide should: Option A. Provide advice based on personal experience. Option B. Suggest the resident speak with family or a financial advisor. Option C. Review the resident's bank statements. Option D. Offer to manage the resident's money. The correct answer is option B. Suggest the resident speak with family or a financial advisor. Question 13. A resident refuses to take a bath. The nurse aide should: Option A, tell the resident bathing is mandatory. Option B, force the resident into the shower. Option C, respect the resident's choice and explore reasons for refusal. Option D, report the resident as non-compliant without discussion. The correct answer is option C, respect the resident's choice and explore reasons for refusal. Question 14. When communicating with a resident who has hearing loss, the nurse aide should: Option A, shout loudly into the resident's ear. Option B, face the resident and speak clearly at a normal pace. Option C, use only written communication. Option D, avoid communicating with the resident. The correct answer is option B, face the resident and speak clearly at a normal pace. Question 15. If the nurse aide must leave a resident's room during care, they should: Option A, leave the door open while gone. Option B, ensure the resident is safe, call light is within reach, and side rails are as ordered. Option C, leave quickly without explanation. Option D, ask the resident not to move. The correct answer is option B, ensure the resident is safe, call light is within reach, and side rails are as ordered. Question 16. A resident suddenly begins to choke during a meal. The nurse aide's first action should be: Option A, call for help and begin the Heimlich maneuver if indicated. Option B, leave the resident to find a nurse. Option C, give the resident water. Option D, slap the resident on the back 10 times. The correct answer is option A, call for help and begin the Heimlich maneuver if indicated. Question 17. A resident's family member asks the nurse aide to keep a secret from the nurse. The nurse aide should: Option A, agree to keep the secret to maintain trust. Option B, politely decline and explain that information affecting care must be shared with the nurse. Option C, tell the family member secrets are against facility policy. Option D, share the secret with other residents. The correct answer is option B, politely decline and explain that information affecting care must be shared with the nurse. Question 18. When using a fire extinguisher, the acronym PASS stands for: Option A, pull, aim, squeeze, sweep. Option B, push, activate, spray, stop. Option C, pull, activate, shake, sweep. Option D, push, aim, shake, stop. The correct answer is option A, pull, aim, squeeze, sweep. Question 19. A resident's vital signs are: temperature 101.2 F, pulse 96, respirations 24, blood pressure 148/92. Which finding should be reported immediately? Option A, pulse. Option B, respirations. Option C, blood pressure. Option D, temperature. The correct answer is option D, temperature. Question 20. A resident's rights include all of the following except: Option A, the right to privacy. Option B, the right to refuse treatment. Option C, the right to be free from abuse. Option D, the right to administer their own medications without any oversight. The correct answer is option D, the right to administer their own medications without any oversight.